Did you know that over 80% of people who use baking soda have no idea about its most powerful secrets? That's right. This everyday kitchen staple, which costs just pennies per dose, is quietly sitting in millions of homes, hiding its true potential. In fact, many experts call baking soda the most overlooked medicine on Earth. Think about it. How many times have you reached for baking soda to bake a cake or freshen up your fridge without ever wondering what else it could do for you? What if I told you that this simple white powder has a long history of surprising uses, some of which could completely change the way you look at your health? Why is it that so few people talk about the real power of baking soda? And what are we all missing out on? In this video, we're going to explore the incredible health benefits of baking soda that very few people know about. I'll also share the important precautions and reveal exactly who should be careful when using baking soda. You definitely don't want to miss this, especially if you care about your health and want to make informed choices. Before we dive into the health benefits of baking soda, if you're new to our channel, welcome. Let's grow together. Don't forget to like this video and subscribe so you never miss our upcoming content. Your journey to better health starts here, and we're so excited to be part of it. Oh, and let us know where you're watching from by dropping your country in the comments. We'd love to hear from you. All right, let's get started with the amazing health benefits of baking soda that could transform your wellness routine. Now, before we dive into these remarkable benefits, let me introduce myself. My name is Dr. Robert Mitchell, and I've spent over 30 years practicing geriatric medicine, helping older adults navigate their health challenges and optimize their well-being. In 3 decades of clinical practice, I've learned to carefully separate medical fact from fiction, especially when it comes to home remedies and natural treatments. And here's what genuinely surprised me during my recent review of the medical literature. Studies published in prestigious journals like the American Journal of Medicine are showing that something as simple as baking soda can actually slow the progression of kidney disease in certain patients. As a physician who has treated countless seniors with kidney issues, this caught my attention immediately. You see, in my years of practice, I've noticed that many of my patients, particularly those in their 60s, 70s, and beyond, often ask me about simple, affordable remedies they can use at home. They want to know what actually works and what's just wishful thinking. That's exactly what we're going to explore today. But this isn't some new health fad. What we're seeing is modern science finally catching up to what our grandparents instinctively knew. The difference is, we now have rigorous clinical trials and peer-reviewed research backing up these traditional uses. However, and this is absolutely crucial, we need to address the elephant in the room right away. The American Heart Association warns that just 1 teaspoon of baking soda contains over 1,200 milligrams of sodium. That's nearly your entire daily recommended limit if you have high blood pressure. So today, we're not just going to talk about the exciting benefits. We're going to have a balanced, scientific discussion about who can safely use baking soda, who should avoid it completely, and exactly how to approach it if it might be right for you. By the end of this video, you'll understand not only what baking soda can do, but more importantly, whether it's something you should even consider for your specific health situation. Let's start with the science. Let's start with the basics, because understanding what baking soda actually is will help you understand why it works the way it does. Baking soda, formerly known as sodium bicarbonate, is an alkaline substance composed of sodium, hydrogen, carbon, and oxygen. Now here's the key. On the pH scale, anything below 7 is acidic, 7 to 8 is neutral, and 8 to 14 is alkaline. Baking soda has a pH of about 8.3, making it alkaline. Why does this matter? Well, your body normally maintains a very tight pH range of 7.35 to 7.45 in your blood. But different parts of your body have different pH levels. Your stomach, for instance, has a highly acidic pH of around 1, and that's normal and necessary for digestion. The magic happens when this alkaline substance meets acid. It neutralizes it. Think of it like this. If you've ever used baking soda to put out a grease fire, you've seen this principle in action. Now, your body is incredibly good at maintaining its pH balance on its own. Your kidneys, lungs, and other organs work around the clock to keep things in the right range. But sometimes, and this is where the research gets interesting, sometimes a little help can make a real difference. That's why some doctors suggest using sodium bicarbonate to help certain cancer treatments work better, because some chemotherapy drugs need alkaline conditions to be most effective. But let's get practical. What does this mean for your everyday health? Let's talk about something most of us have experienced. Heartburn. You know that burning sensation that creeps up your chest after a big meal? Or maybe it's that sour taste that wakes you up at night? Heartburn happens when stomach acid moves back into the esophagus, and baking soda works by neutralizing that excess stomach acid. It's not just folk wisdom. It's actually the main ingredient in Alka-Seltzer. Here's how it works. When you mix baking soda with water and drink it, the sodium bicarbonate reacts with the hydrochloric acid in your stomach, creating salt, water, and carbon dioxide. That reaction neutralizes the excess acid almost immediately. A study published in BMJ Open Gastroenterology found that people who consumed bicarbonate-rich mineral water experienced significant relief from heartburn symptoms compared to those who drank a placebo. But here's what you need to know. This is for occasional use. People should not use sodium bicarbonate for longer than 2 weeks at a time. And there's another important consideration. If you take other medications, you shouldn't take baking soda within 2 hours of them, because it can slow down how your body absorbs some medicines and change how others work. If you want to try this for occasional heartburn, you could start with just 1/4 teaspoon mixed with a glass of water. Some people use a full teaspoon, but working up to that gradually is better since some people experience diarrhea, gas, nausea, or vomiting from taking too much. And timing matters. Drinking it after eating is best since you need your stomach acid to digest food first. Now here's something that might surprise you. Elite athletes have been using baking soda as a performance enhancer for decades. And I'm not talking about some underground secret. This is well-researched, legitimate science. When you exercise intensely, think sprinting, jumping rope, or lifting heavy weights, your muscles produce hydrogen ions and lactate, which increases acidity in your blood and muscles. This buildup limits exercise performance and causes that familiar burn during intense exercise. According to the International Society of Sports Nutrition, sodium bicarbonate supplements mainly improve athletic performance in short, high-intensity exercises lasting between 30 seconds to 12 minutes. A 2020 meta-analysis found that sodium bicarbonate supplementation does improve muscle endurance, though not muscle strength. Another small study from 2021 involving trained cyclists found that those who took sodium bicarbonate had better all-out performance during a simulated race. The typical effective dose is 0.2 to 0.5 grams per kilogram of body weight. For a 150-pound person, that would be about 14 to 34 grams. That's roughly 3 to 7 teaspoons. But here's the thing. This can cause serious gastrointestinal distress. We're talking nausea, cramping, and diarrhea. Athletes call this soda loading, and it can make you sick if you get too much too often. If you're an athlete interested in this, you absolutely need to work with a qualified sports dietitian. Don't just start experimenting on your own, especially before a competition. Now we come to what I consider the most significant recent development in baking soda research: its effects on kidney health. People with chronic kidney disease often develop acidosis, a buildup of acid in the blood, because their kidneys can't get rid of enough acid each day. This acidosis can cause bone and mineral loss, muscle wasting, and other serious problems. A major study published in August 2024 in the American Journal of Medicine followed 153 people with high blood pressure and high risk of worsening chronic kidney disease. Those who took 2 daily doses of baking soda, 4 to 5 650 milligram tablets, showed slower kidney disease progression over 5 years compared to those who received only standard medical care. This wasn't just a small improvement. We're talking about potentially delaying the need for dialysis, a life-changing outcome for people with kidney disease. Now, let me be crystal clear about something. The study didn't show improvements in blood pressure or cardiovascular disease risk. And this research applies specifically to people with existing kidney disease under medical supervision. As one kidney specialist explained, if you do not have kidney disease, your kidneys are probably doing a perfect job of getting rid of all the extra acid in your body. This is absolutely not something you should try on your own if you have kidney problems. Sodium bicarbonate is commonly used in people with acute kidney injury to reverse acidity in the blood, but this requires careful medical monitoring. Let's talk about something you can actually see and feel. Oral health. Baking soda has earned its place in countless toothpastes for good reason. Research published in the Journal of Clinical Dentistry found that toothpaste containing baking soda were significantly more effective at removing plaque and whitening teeth than those without it. Another study showed that baking soda can help reduce harmful bacteria in the mouth. Here's why it works. Baking soda acts as a gentle abrasive, effectively scrubbing away surface stains from coffee, tea, or other foods. Unlike harsh whitening treatments, its mild texture helps polish teeth without causing significant damage when used properly. But there's more to it than just whitening. Because baking soda is alkaline, it helps neutralize acids in your mouth. This creates a less hospitable environment for harmful bacteria, supporting healthier gums and fresher breath. Dentists recommend using it just a few times a week and always with a soft, bristled brush, because using it too often or brushing too hard can wear down tooth enamel over time. For mouthwash, you can add half a teaspoon of baking soda to half a glass of warm water and swish as usual. Some research suggests this can help with canker sores by reducing pain and promoting faster healing. There's also emerging research on anti-inflammatory effects. A 2018 study found that drinking baking soda water for 2 weeks shifted immune cells from those that promote inflammation to those that reduce it, which could potentially help with conditions like rheumatoid arthritis. Now we need to have a very serious conversation about safety, because this is where things can go wrong. And I mean seriously wrong. First, let's talk about sodium content. 1 teaspoon of baking soda contains more than 1,200 milligrams of sodium. The American Heart Association's ideal daily sodium limit is 1,500 milligrams per day for most adults, especially those with high blood pressure, and no more than 2,300 milligrams daily. That means just 1 teaspoon puts you at or over your entire daily sodium limit. Baking soda supplementation is absolutely not recommended for children, those who have cardiovascular issues, acidosis or alkalosis, and people who are pregnant. If you have high blood pressure, this is especially important. As Dr. Greg Fonerau from UCLA explains, the excess salt retention can raise blood pressure levels. When there's excess sodium in your bloodstream, it pulls more water into your blood vessels, boosting the amount of blood moving through them and driving up blood pressure. Sodium bicarbonate can affect the heart, and there have been cases of baking soda overdoses causing cardiac arrest when the heart suddenly stops pumping blood. Even more concerning, research has shown that in patients with heart disease, sodium bicarbonate can cause decreased cardiac contractility, increased serum osmolality, peripheral vasodilation, and decreased ionized serum calcium. Baking soda can interact with numerous prescription medications, including mecamylamine, methenamine, and tetracycline antibiotics. It can also interact with over-the-counter antacids. Taking too much baking soda can cause poisoning due to its high sodium content. When someone takes too much, the body tries to correct the salt balance by drawing water into the digestive system, which can cause nausea, vomiting, and in severe cases, gastric rupture. If you're still considering trying baking soda after everything we've discussed, here's how medical experts recommend approaching it safely. Some recommendations suggest no more than 1/4 to 1/2 teaspoon per serving, limited to 3 teaspoons per day maximum. But even that might be too much for some people. For occasional indigestion, start with just 1/4 teaspoon mixed with a glass of water. See how your body responds before considering anything more. Drinking it after eating is best since you need your stomach acid to digest food first. Some people limit consumption to the morning since the drink can interfere with sleep, likely due to the sodium making the heart work harder to move blood throughout the body. Here's what every expert emphasizes. Talk to your doctor first. As registered dietitian Destiny Moody puts it, people trying to go viral do not have your health and safety in mind. They also lack the knowledge and responsibility to caution others to seek medical advice before trying supplementation like this. Remember, people should not use sodium bicarbonate for longer than 2 weeks at a time. If symptoms persist longer than this, it may indicate an underlying condition that requires medical treatment. If you have any ongoing health conditions, regular medications, or are over 60, you need professional guidance. You may need to be monitored regularly for treatment problems. So where does this leave us? After reviewing all this research, I think there are 3 key takeaways. First, baking soda is not some miracle cure-all, despite what you might see on social media. It's a simple chemical compound with specific, well-documented effects. Some beneficial, some potentially dangerous. Second, the most compelling evidence is for very specific uses. Occasional heartburn relief, potential athletic performance enhancement under professional guidance, and kidney disease management under strict medical supervision. The emerging research on inflammation and other conditions is interesting, but still too preliminary to base decisions on. Third, and most importantly, this is not something to experiment with casually. A 2013 case study in the Journal of Medical Toxicology concluded that baking soda is not a particularly healthy food item, especially for people already struggling to keep their blood pressure under control. You know, in my years of health education, I've seen too many people get excited about natural remedies and forget that natural doesn't always mean safe. Baking soda is a perfect example. It's been used safely for generations, but always in small amounts occasionally, and by people who understood its limitations. If you're dealing with chronic heartburn, exercise performance issues, or kidney problems, don't reach for the baking soda first. Reach for your phone and call your doctor. These are complex health issues that deserve professional attention. But if you occasionally get heartburn and want a simple remedy, and you don't have high blood pressure, heart disease, or kidney problems, then yes, a small amount of baking soda in water might help. Just remember, 1/4 teaspoon is plenty to start with. Thank you for taking this journey with me today. I hope this conversation has given you the information you need to make an informed decision about whether baking soda has a place in your health routine. Remember, when in doubt, always consult with a healthcare professional. Your health is too important to leave to guesswork. Take care of yourselves, and I'll see you next time.